Hello, Mom.
Hello, Deli.
It's good to see you. I just saw you yesterday and the day before yesterday.
Yes, you did.
I see you all the time.
Yeah.
Um, we've had a big week.
Yeah.
It's been a hard week.
It's been a very hard week. It started out on Monday with your dad being super, super sick. And I said, we have to go. I have to call 911. To which he said, no, and would not go. But we've got him to the hospital. And he was in very, very bad shape. He has, um, he has a chronic disease, emphysema, and he had lost most of his lung function. And so he went there and that was kind of a little bit of more touch and go, and then moved into ICU, where he is currently the king of ICU in all of his glory.
Yes, because he's very sweet and would be very kind to everybody who checked in on him and all his doctors and nurses. Always love him.
Always. And
It's a real study in contrast.
to us, or just to me.
I don't know, maybe just to you.
Maybe just to me. I think so. I mean, I watched him today thanking every single nurse, doctor, therapist for doing whatever they did to him. Oh, thank you. And I thought, what? But he's just so kind, but that's who he is. That has been sort of tiring.
Yeah.
I'm fine, and I have my little dogs. But you do, when you're alone, you do start sort of weirdly talking to your dogs a
Oh, I
lot.
talk to my dog all the time. Dogs
Oh,
are
yeah.
very healing.
I know. And they know that when I say, okay, let's go to bed, they usually go right to their crates because that's what they're supposed to do. But they know that since John's in the hospital, they can sleep with me.
That's better than a mutiny. No, you go to your crate.
Yeah, we outnumber you,
Yeah.
sweetheart. We'll zip you up and
It's a
give
dog's
you a
life. Have a greenie, old lady.
We own this. So this is going to be an exciting episode. Yeah.
Yes, I'm really happy about this episode because it deals with things that I feel are very much in the front of my mind right now. In that I have my adolescent son is now driving the streets of LA with his driver's license.
Yeah.
And we're going to talk about all kinds of stresses of your child's road to autonomy. Literal, figurative. So, Mom, what's the one thing you remember most about teaching me to drive?
That was something. I remember that I gave white knuckles new meaning. I would just sit there and breathe and sigh and clutch the seat. And when you had your license and you were just full of confidence and you were driving through town, when you suddenly turned left on red in front of a truck, and I thought my heart would stop. And I can remember yelling, and I gripped the dashboard and really shouted, "What are you doing?"
And you said, you can't do that. You can't turn left on a one way or whatever, because I didn't even know the rules. And I was so blasé about it. I was like, oh, you can't.
Yeah, you said, "Oh, I thought you could turn left on red."
I know. I was like the Californians. I was like, skirt. I didn't even think that anything was such a big deal.
So now you're a mom of a driver.
Now it's my turn to stress out because my oldest just got his driver's license. And that is why we chose today to talk about stress, all the stress.
So today we are diving into a topic that every parent of a teenager knows all too well: stress.
From academic pressures to social challenges, and yes, even that nerve-wracking rite of passage known as learning to drive, adolescence is full of high-stakes moments. So today we are asking what's normal stress and what's a red flag, and how can we support our kids without over hovering? And maybe most importantly, how can we as parents manage our own stress while raising independent, resilient teens? So to help us unpack it all, we are thrilled to have Dr. Marisa Crandall with us. Marisa LaDuca Crandall has a PhD in clinical developmental psychology and was a school psychologist and school mental health provider and administrator for over 20 years. Dr. Crandall now practices as a mental health coach and consultant, working with individual families and institutions to help people thrive. She lives here in Los Angeles with her partner of 35 years, their two dogs, and with two young adult daughters. Marisa, welcome. We're so excited to have you on So
Thank
Mom. We have worked together for over 20 years.
You're the best boss I ever had,
Oh,
and I'm so happy to count you as a friend now after all of that time.
so share with us a little bit of your journey, your passion for adolescent development, and also what allowed you to shift from a very established career to something a little scary, going out on your own?
Yeah, thanks. I realized that every job I've ever had, with the exception of working at Burger King when I was in high school, has been in an educational institution as either a student, a teaching assistant when I was in grad school, or working in a school or a summer camp. And it's not that I necessarily set out to do that. But I'm so glad that this is the path that I have been on. As you noted, I have two young adult daughters myself who have not been the easiest kids to raise. And yeah, I started working at I was a school psychologist from graduate school, and so I did a lot of assessments. And what I didn't like about that was I would spend all this time with this kid and this family, learning all about them. And then I would give them their report and their recommendations, and they would toddle off, and I would never see them again. That didn't feel good to me. I started working in the boys' school. I loved it. My office was situated in the middle school for boys. And I'm not going to lie, I judge people by how they feel about middle schoolers. Because you love them or you hate them, but I love them, and I just think it's such a wonderful time, and
It's such a hard time.
it is a very hard time. I went around I went around at a dinner party once, and because I don't like small talk, and I always try to come up with a question, and my question was, would you go back to middle school for $1 million? Nobody said yes.
Nobody would do it. Imagine having to do eighth grade twice.
Nobody would. But I love those kids. I love that age. And when the schools merged, I was able to get a relationship with you, Priscilla, I mean, you've been really a mentor to me through these years. And it was hard because, as we would always joke about, like, people don't come to me when their kids are doing well in a school. It's not like I get to have sort of joyful conversations a lot of the time. But working through the schools and being in the schools, what I was able to learn is the way that middle schoolers, high schoolers really, what they benefit from. They really desperately actually want adults to talk to about the things that are important to them. And the reason why they don't do it is because we're often too reactive. We often freak out, and then they don't want to talk about it, especially things that are painful or anxiety provoking for them, because when you say it out loud, it becomes more real and it becomes bigger. So if the adult that you're trying to confide in can't contain it for you, it just makes everything a million times worse.
Oh, that's so interesting.
Yeah.
And so that's why, Priscilla, this every time I address parents, I say, look, the developmental task of adolescence is to develop self-regulation. The task of the parent of the adolescent is also to work on your own self-regulation, because of course we get activated and excited or emotional when our kids are, but that's actually not helpful for them.
That's a really interesting point, Marisa, and I wonder if you'll talk a little bit more about it, because from my perspective, that's what I saw. I mean, parents would come to talk about their children, and then I would find them so dysregulated,
Yes.
and and you had to deal with it on a professional level. I could just say, let's back up a little, and maybe you need to go see Dr. Crandall.
It's the hardest thing, right? I mean, we are biologically wired as parents to be activated when our children are activated, right?
Mm-hmm.
The problem is that our nervous systems evolved in a time of scarcity and much more danger. And today, our nervous system doesn't understand the difference between our child is upset or our child is in life-threatening risk.
Right.
Right. So as a parent, it feels when you see your child upset, it feels like it's an existential risk. Your child could die from this. Right. So of course we get very activated. So it's natural, but it's not helpful if we come at the kid with our emotions or any really strong emotions at all. What I always talk about is, as a parent, as a psychologist, as a coach now, what we try to do is create a safe container for the kids to have whatever feelings they need to have and to express it any way they need to express it. It doesn't mean all behaviors are okay, but just to allow the child to know that they can express it and that you're not going to freak out.
I remember one of the things that I love that you would say to kids, because they learn some of the language, the
Mm-hmm.
psychological language. So they would say, I felt unsafe. And you would say, did you feel unsafe or did you feel uncomfortable?
Mm-hmm.
And that's something that I remembered
Mm-hmm.
because I thought it was so wise. Did you really feel unsafe? I mean, there are times when kids
Yeah.
do feel unsafe,
Yeah.
but a lot of them say, I feel unsafe when they really mean I'm not comfortable.
Yeah. Right. It's the concept of sort of psychological safety. And there is psychological safety, but more often than not, again, and I think you're right, in our culture, it gets discomfort is equated with lack of safety. And for parents, the same thing. They see their child upset, they get activated. Oh my God, it's a safety concern. It's not a safety concern. And in fact, kids need to be uncomfortable in order to develop the tolerance for discomfort that is required to grow and to learn. If we're never uncomfortable, we don't grow and we don't learn. And it actually backfires on us because the range of which we can tolerate things becomes very small. And then our lives become small because we can't challenge and we can't tolerate what that discomfort feels like.
Sometimes it's hard to tell what's normal stress and good
Yep.
stress, and what are signs we need to step in. And
I always think that because my mom and I were sort of close in age and and I grew up pre-internet, and I feel like mom was an empathetic parent. And so when I had things that were going wrong, mom would say, well, this really reminds me of when I was, mom always had a story that was comforting and sort of activated me to a place where I felt like, oh, my mom gets it. My mom gets, that I wore the wrong thing, or that I now feel I was a much older parent to
Mm-hmm.
my children,
Mm-hmm.
and my children have grown up in this internet age where I honestly feel like I'm the great 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 grandparent of my child, and mom is the great 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 grandparent. But there's been like four steps, and so the stress that I sometimes feel
Mm-hmm.
as a parent raising children today is that I can't really pull back much, even though I feel like I have this great parent. I can't pull from what I know. It
Mm.
feels like a really new time.
It's a different world. I think you're 100% right. We talk about how it's hard to be a kid today. It's also really hard to be a parent of a kid today because, just what you said, we can't pull from our own experience, and also because we don't know where things are going, right? If you think about, for example, AI today, 5 years ago, it was nothing. We couldn't have predicted. Now my text messages are previewed for me on my phone.
Yeah.
Yeah. Maybe
All of
you'd
that.
want to say this differently. Okay, AI.
I mean, so it is very, very scary. And of course, the most anxiety provoking thing is uncertainty.
Yes.
Right? So for parents, of course, we're very anxious. We don't know what to tell our kids. What we thought worked for us, or what our parents told us that worked for us, isn't necessarily going to work. And we don't even know what the world's going to look like in 5 years.
No, and our kids are catching on to these long soliloquies that if we tend to give them about
Yes.
our own youth are just
Yes.
not resonating with them.
No.
So I always feel like, wow, I'm really ineffectual. I
I'm
really
Charlie
don't get
Brown's
it.
teacher right now.
I am. Womp, womp, womp.
Exactly.
But I think that's always been true. I remember saying to a mom, your daughter needs to come home to feel as though this is a safe place and everybody loves her and you're happy with her.
Yes.
And not feel as though everything she does is something to be solved. Not that she's a disappointment, but that you have to solve all of this.
Yes.
And I think that parents are losing their, particularly I've seen this more with moms, they're losing their own sense of identity.
Yes.
They're burdened by the job.
Yes. I mean, one of the things I always say is the greatest gift a parent can give their child is to see their child clearly for who their child is.
Mm-hmm.
We can't help it. As parents, we have all these hopes and dreams for this little baby. And, often that little baby grows into a person that's quite different than the idea that we had or what we wanted or, hoped for. And that can be painful and hard. But to your point, what every human being needs is to be greeted with unconditional love from the people who are important to them. So for children, those are the adults in their life, right? The other thing that I think is really important is to realize that people do their best, especially kids. They really are, they're doing their best to garner positive regard from the people that matter to them. And again, that's their teachers, that's their parents, that's their peers, that's their family members, right? So if they're doing something that is not garnering them that response, then there's an issue here that can be solved or should be looked into, right? One of the biggest problems, though, that I see, and I think you're the one, Priscilla, who told me this term years and years ago, but it's interviewing for pain, right? So the child comes home from school and maybe they don't look happy. Maybe they're just tired. Who knows? But often the parent who's anxious will start saying, what happened? Why are you upset? What didn't go well? Who was mean to you? Right? And so then it becomes the child is getting a lot of attention for the negative things that happen to them. They're not understanding the power of what we now know is in positive psychology and sort of, the importance of looking for the good in things. And then it gets the parent very wrapped up in, to your point, trying to prevent this discomfort or this pain or this suffering from their child. When again, the child needs that discomfort in order to grow. And the other reason why it's problematic for kids is when we hit them with all of our anxiety, what they hear from us is that we don't believe in them, that we don't think they're good enough, that we don't think they can handle it. When we rush in and start telling them how to do things and we start micromanaging and we say, well, we're going to get you a tutor for this and we're going to, again, what they hear is, oh, I'm clearly not competent.
I think that as a parent, I'm always wondering, when do I step in? When do I step back? When is it time to call in some sort of the tutor, the professional support? I mean, could you talk a little bit about that? Because I think that's my endless.
Yeah. I always start from the idea again, if we're talking about an adolescent, one of their main developmental tasks is individuating from us, right? Their nervous system is screaming for autonomy, right? So I always start from trying to say, okay, how can I respect this child's autonomy and partner with them to figure out what's happening, right? So that's really important thing is to join with them and for them to know that you are a team together, that you are not going to direct them or make them do things mostly, right? Obviously safety issues, we have to be more controlling, but they're very sensitive to being controlled to having to obey, right? Human beings don't want to be oppressed, right? We just don't. And for adolescents, they're highly sensitive to us overstepping. And if they have any kind of neurodiversity, also there's often a lot of demand avoidance stuff that goes with that. So I start by trying to center the kids' autonomy. What is the goal here? And can we together identify a goal together? That's both of our goal, right? Because I think one of the problems that we come along with is the parent has a goal. That's not the child's goal. Right. So we're pushing them towards the goal. That's really what we want, and it's not what they want. And then we're disappointed when they're not fully excited about it or doing it. The other thing I do with kids, you always sort of, if your child presents to you with distress, it's always good to start with some kind of question along the lines of, do you want to vent or are we problem solving here? Or both.
Yes.
Oh, that's good.
Yes.
Because again, we as parents, our children are suffering. We want to fix it.
Right.
And we rush in and fix it. And often they don't want us to fix it. They just need to vent. They just need to be heard. They just need to be validated. And they want to figure out if they even want to fix it or not. It might just be something that they just have to get out. So I think it's really important to sort of start from this, like, what kind of conversation are we having here?
Right. We'd have this child, we were sort of trying to figure out what the right this plan is, what the right that plan is. And he's an artist and he wanted to apply this year to sort of these various internships and things. Neither of us are artists. So we were just naturally thrown off the bus because we couldn't help with that portfolio. We couldn't give him any kind of, we were not domain experts on any of this. So it was kind of wonderful in a way. Yeah, it was a relief. And there was something that it was only 4% of people. So we would sit and talk about it. We're like, only 4% acceptance, only 4. And then I wouldn't talk about it. I would say, don't talk about that. Don't put your anxiety on it. And just this morning, I asked about this 4% acceptance program. And he looked at me and he said, no, 40%. And it was just, I thought, I'm so glad I didn't go down that rabbit hole. I'm so glad I've just let all of this be, whether it's 4 or 40, doesn't matter. It's his program to get into or not get into.
Yes, and then you will be there to pick up the pieces and or celebrate. When my kids were younger, them feeling or being excluded socially was the worst thing for me. Like that was my trigger. That was like send me to my to my bed.
Oh yeah.
But I knew that I couldn't do that in front of them. And also, I was the psychologist at their school. So I couldn't really be like, that girl's horrible. Or how dare she do that to you? Right. But I had my go-to friend, and she knew I would be like, I need to talk. I need to talk to you. Coco, just say I'm crying. I need to tell you something.
Yes.
And so I do encourage parents, don't put it on your kids, but find other people that you can talk to about it who can help you. Again, is this a venting conversation or a problem solving conversation?
Right.
But just someone who you can let your anxiety off on. And if it's your co-parent, that's great, but sometimes that's not helpful either. So identify someone in your life. And if you have to pay someone to do that, then do that. If you're fortunate enough to be able to do that. I say that all the time. If you can afford to pay someone to take some of this, then you should, because a lot of times I hear parents get upset. Oh, my daughter won't talk to me about this, or my son won't tell me this, and I know something's going on and she doesn't want to talk to me about it. Well, okay, then find her someone who she will talk to. Right. And don't be hurt about it. It's not about you necessarily. Maybe there's something in the relationship that makes it harder. And if you're open to it and you have the right person who can talk with your child and with you and figure out what's the missing piece there, that's great. But also, it's probably just that you're their mother and they're afraid of disappointment or sadness or making you upset or making you anxious, and therefore they can't do it.
I think in some ways that can be really hard, and to sort of not be the star of that show, to say, I am not the go-to for this particular problem in my child's life. I'm not the first line. You want to be for everything. You want to be this great big basket to catch everything. And it's weird to think, maybe I'm not.
I mean, people always say to me, "Oh, you must know everything to do with your children." I'm like, "Are you kidding? My children have each had their own therapists, like
Yes.
Yeah.
since middle school,
Yeah.
like both of them."
We're such a therapy family.
It's, I think everybody should be engaged in some form of self-reflection, guided self-reflection. I think it's education, and I think it's, very, very important.
Yeah. Yeah. We were talking about launching, how life is a series of launching your child. You launch them, and then the first time they come home from college.
Mhm.
But there really is a launch that I hadn't thought about, except that now I'm in it, which is the driver's license launch and losing that
Mhm.
time in the car. And
Mhm.
even though we have these little trackers now where I can watch where he goes, I also feel like, well, I can watch as much as I want where he's at. He'll tell me where he is. It's really more that I've lost the car time with him.
Mhm.
He wants to be by himself in the car.
Yep.
But what was it like the first day? Do you remember the first day you drove by yourself, and what a shift it was?
You'll be so sad to know where I went the first time. You might as well know now.
Oh, I won't be surprised, my darling.
I got a Shamrock Shake.
Yeah.
And then I went straight to the tanning salon. It was prime 1987.
Yeah, there you go. When we were kids, Adele, we would just go out in the car and be gone, and our parents really didn't know where we were.
It's so different now. I mean, I'm always tracking my kids. It's like my hobby.
We should have some takeaway tips
About stress,
driving,
being a
about
good driving parent,
Mhm.
and life milestones.
life milestones,
Yeah.
friendships.
Now, one of the questions that keeps coming up is sort of, how do you know what's normal or okay stress, and how do you know what's not?
Yes.
Right? So the full range of emotions are quote unquote normal, right? And as my colleague Lisa Tamoro always says, good mental health is not being happy all the time. It's having emotions and feelings that match the environment, match the things that are happening.
Yes.
Right?
Yes.
So even though we don't want to be sad all the time, when something that is sad happens, we should feel sad, and that is mental health.
Yes.
Okay. So part of mental health is having the full range of emotions that match what's happening or seem appropriate for what's happening, and developing coping skills that help you feel better and don't hurt anybody, including yourself. Mindfulness is a really important skill for everybody in the family. My kids hated it, but every day after dinner, we were an eat dinner together family as much as we could be, and I would put my phone on the table afterwards with a meditation app, and we would do a 5 to 10 minute meditation together. They hated it. They kicked and screamed.
I love it.
But I was like, this is something we're all doing together because it is all good for us.
Yeah.
So helping kids learn when they are dysregulated emotionally, when they're activated, and some ways that they can help themselves get more in balance. And that can be anything. It can be different for different people. It's walking a dog, cuddling an animal. It can be, physical exercise. It can be mindfulness. It can be cuddling. It can be, sometimes you just want to be joked out of your mood, and that's fine too. So what's your go-to for that? Most of the kids that I know use their phones in some way as coping strategies and as avoidance strategies. And so again, we don't want to say to our kids, you can't use your phone, right? I use my phone when I'm standing in line and I feel uncomfortable. Of course I bust out my phone, right? So again, we don't want them to think that we don't understand how it's used, but we do want to help them be reflective about, is this something you're using effectively and not harmfully? Is it something that is becoming more harm than it is help? Kids need us to put the guardrails in place so that they can internalize those guardrails eventually, right? But if we only keep the guardrails and we never sort of give them any room to play or to, God forbid, fail a little bit in some area, then they don't develop the confidence to even try any of that stuff.
Well, I realized in some ways I could be the employee. And that, getting the kids to just do more sort of old-fashioned chores. Like, I thought there was just that epiphany. I think I was very late to it, but I was like, what are people around here helping?
Exactly.
What's going
Nobody
on?
else can empty the dishwasher.
That's right. That's like, come on, everybody. This is all this hour of prep, setting the table. And that was very calming for me, because that otherwise I just thought, are they doing homework? Are they on devices? Are they doing homework? It's like, well, maybe we just all do this together, as long as I'm in here trying to get dinner going. Maybe this whole thing becomes a group effort. We've been doing that more lately.
I think that's great. I think it's great on a number of levels, not just because like you're together and you're not worrying about them being on the phone, but also, again, kids having a job to do helps them feel like a competent human being and like a necessary human being and like a part of the team.
And isn't that true for all of us?
Yes.
I mean, when you have a job to do, you do feel, it can be hard, challenging. It can make you feel miserable. But it also gives you autonomy. It gives you a sense of self, and it's valuable and important.
Yeah, a sense of purpose.
And a sense of purpose.
And being connected.
Yeah.
Right, that you matter.
That's right.
Right. I need you to do this. If you don't do this, it's not going to get done.
Right. And maybe just a little bit of a reckoning of like, oh, I guess my mom was always doing this, and maybe she shouldn't have always had to, do the cat litter. Maybe it is my turn to do the cat litter.
Well, this has been so wonderful having you. I'm thinking of all the things that you could come back and talk with us about. Social media. It's interesting that kids resonate with with psychologists who aren't trying to be buddy-buddy, who aren't necessarily trying to be funny, but actually treat them with maturity. So this is our book rec time.
I just finished, it's called Rebel Girl by Kathleen Hanna. It's an autobiography. It is amazing. The subtitle is like a feminist punk, story of a feminist punk. She's a musician, she's a writer, she's an artist. She's just incredible. She's about my age, and she's just done amazing things. And just reading, and also you sort of get a sense of sort of feminism in America since the 80s, because, she's been a very, self-identified active feminist for that time, and just sort of seeing the way the movement and the feelings in that movement have changed has been really, in addition to all the music stuff and the art stuff, which she also brings in. It's great.
Which I love. I have to read that.
Yeah.
That's going to be right on my list.
Sounds so good.
So my book recommendation is a book I read quite a while ago, but I thought, given our conversation, because it's a little controversial, it's The Nurture Assumption by Judith Rich Harris. Do you know that? And it's, the point is, have you ever wondered how much parents are shaping their kids' personality? And this book challenges that assumption, says, so much of it is their peers, and the peers are so much more important than parents, and they have a far greater influence on a child's development. And I think every parent should sort of back out a little bit. They're not the star of the show. And I think that that's important.
Huge.
And I have two. I have Turtles All the Way Down by John Green, which is
I love
a
that.
book I loved. I read as an adult, and it has themes of OCD, but so much more. And then We Are Okay by Nina LaCour, which is just this beautiful, it's sort of a grief and loss story. Okay. And I read that again. I read it when I was, in my 40s. And I think of those books as being wonderful books that I wish I had been able to have access to when I was a young adult, rather than a young adult writer.
So thank you so much for joining us. This has been so much fun. I feel as though the conversation just created so many more questions that I want to ask you, but I've spent 20 years saying, Marisa.
Yes, so we're going to extend it for 5 more hours.
Yeah.
Can't leave.
Yeah. But maybe you'll come back.
I always will come back.
Thank you.
Thank you so much.
Thank you so much.
Thank you.